Today we'll be demonstrating use of the Easy Breathe ventilator manufactured by Engler Engineering Corporation. For the purpose of this demonstration, we are using a test lung instead of a patient. The test lung is similar to a reservoir bag, except that it has certain internal structures and banding to make it act more like a real lung. To start the ventilator, first turn the flow meter to 3 to 4 liters per minute. The purpose of this is to fill the reservoir bag. You can also adjust the vaporizer to an appropriate setting. The anesthesia machine should now be connected to a patient. In our case, we're using a test lung. Once the reservoir bag appears full, you can turn the flow meter down to about 1.5 liters per minute. To adjust the controls, first set the breaths per minute. In most cases, setting the indicator to the dot at about 10 breaths per minute is fine. The peak pressure is also set to the dot, which is about 15 centimeters of water, which is appropriate for the vast majority of patients. The inspiratory rate is set according to the size of the patient. At this time, it is not very critical to get started, so set for S, small, for patients in the 10 kilogram range, M for medium in the 20 kilogram range, L for large in the 30 to 40 kilogram range. To start the ventilator, press the start button and immediately release it. We are now ventilating the patient. As can be seen by the bag, the test lung is inflating as the reservoir bag compresses. And looking at the manometer, we see the pressure goes up to about 15 centimeters of water. To turn the ventilator off, press and release the start button. We will now go into detail on how to set and adjust the controls. Breaths per minute control. The breaths per minute control, as its name implies, simply changes the number of breaths delivered each minute by Easy Breathe. For most patients, somewhere in the neighborhood of 10 breaths per minute is adequate. For some small cats, small dogs, you might want to increase it. Changing the breaths per minute does not change any of the other parameters. As you can see, the inspiratory rate stays the same, the peak pressure stays the same, and the patient is ventilated. Instead of at 10 breaths per minute, it is now 15 breaths per minute. If I change it back, we go back down to 10 breaths per minute. The main reason for changing the breaths per minute is changes in the carbon dioxide levels, the EtCO2. If the EtCO2 is getting too high, we would want to increase the breaths per minute to lower it. In general, you adjust the breaths per minute to keep the CO2 levels between around 20 or so, 20 to perhaps 35. If the CO2 level starts to get too high, the patient will attempt to breathe and will be fighting the vent. The inspiratory rate controls the time it takes for the patient to fully inhale to the selected peak pressure. In most patients, that will be about 1 second. Easy breathe is set to allow normal breaths from inhalation to be from about 0.8 seconds up to about 1.5 seconds. In general, cats and small dogs will be towards the faster end of that range, and larger dogs towards the slower end of that range. Easy breathe shows that you are in the correct range by having both front LEDs stay lit after inhalation with no beeping sound. If the rate is too low, the left LED will light and a beep will sound. This means that you have to turn the inspiratory rate counterclockwise to make it higher. And again, we do it till both LEDs light. If the inspiratory rate is set too quickly, too fast, the right LED will light and the beep will sound. This indicates that you have to turn the dial counterclockwise, again, till both LEDs are lit. Note that if the inspiratory rate is set too low, so that the pressure only goes up a small amount, it does not reach the peak inspiratory pressure, that you will hear the low pressure or disconnect alarm. Simply turning up the inspiratory time resolves this problem. Peak pressure control. The peak pressure control adjusts the peak inspiratory pressure that the ventilator goes to. As you can see, the manometer goes up to about 15 and the inhalation ends and the patient is allowed to freely exhale. If I change the peak inspiratory pressure to 20, we can see that the peak inspiratory pressure will now go up to about 20 before cutting off. There are a number of different reasons for changing the peak pressure, though most patients will ventilate quite well at 15 centimeters of water. One reason might be obesity, in which case you would want to increase the peak pressure. Certain types of lung disease might require you to decrease the peak pressure. In any case, look at the patient. What you want is the patient to be taking nice, normal-looking breaths with the chest expanding in a nice, comfortable way. The most common warning or alarm that you will hear is the low pressure or disconnect alarm. This alarm indicates that the pressure to the patient is not coming up, so that the patient is not being ventilated. If the inspiratory rate is set to low, you will hear the low pressure or disconnect alarm. Simply turning up the inspiratory time resolves this problem. A common cause for this, especially in dentistries, would be that the patient has disconnected from the system. The remedy for this, obviously, is to reconnect the patient and then turn the flow meter up to 3 or 4 or even higher liters per minute until the bag fills and the system restabilizes and comes back to normal. When this does, you can turn the flow meter back down to its normal 1.5 liters per minute. Another cause of the low pressure disconnect alarm might be that the flow meter has been turned off, or that it was never turned on to begin with, or that you've run out of oxygen. The solution for this is simply to turn the flow meter back up, turn it up to a higher flow, perhaps 4 liters a minute, or even higher with a large bag, and wait till the pressure starts to come up. And once it has, simply bring the flow back to the 1.5 liters a minute. Other things that can cause low pressure, the low pressure alarm to sound, are a very leaky cuff, or if you're using an active scavenger, sometimes the scavenger has too much vacuum, either because the filters haven't been cleaned or it just isn't set properly, and this will suck the gas out of the bag, making it very difficult to use the ventilator. In the short term, this can be corrected by turning the flow up to whatever is necessary to keep the bag inflated, but you should have your active scavenger tested and adjusted. One way to tell if the scavenger is the problem is to remove the active scavenger and use an F-air canister or other canister and see if that corrects the problem. In summary, if you hear the low pressure or disconnect alarm, check to be sure that the patient is connected. If the patient is, turn the flow meter up to fill the bag. Just be sure you don't turn it up too high. If you turn it up so high that the pressure is too high, you will hear a pressure alarm and the ventilator will stop cycling. If you lower it back down, the pressure will come down and it will resume cycling. Once the patient is being ventilated and the machine is cycling properly, then go back to look for the cause of the problem. Checking the cuff, checking the scavenger if necessary, checking your oxygen supply. The button on the left has two functions. One is to start and stop the ventilator. The other is a fill and hold. To start the ventilator, we press this and immediately release the button. The ventilator will then start. When you're ready to stop the ventilator, simply press the button again and release it, and the ventilator will stop. Pressing and holding the button will do a fill and hold. The pressure will increase at the rate set by the inspiratory rate control. It will go up to the pressure set by the peak pressure, and it will hold at that level as long as the button is held down. As you can see, the pressure has gone up, and now it is continuing to go up beyond the setting, and the reason for that is we do have fresh gas coming in from the flow meter. Easy Breathe is programmed to allow a slight rise above the peak pressure, but if it gets more than about 3 centimeters above, it automatically cuts out. So that if you want to keep a fill and hold for longer than a few seconds, you must turn the flow meter off while the chest is expanded. Fill and hold has several other functions. One is to give the patient repeated deep breaths. Press it, hold, release. Press and release. This can be used to get your patient quickly under anesthesia. Note that if we turn the ventilator on and it's cycling, you can still do fill and holds. Press, release. The ventilator will take over once you've released. Fill and hold can also be used to test the integrity of the cuff, of the endotracheal tube cuff. The button on the right, labeled Mode Test, also has several functions. When pressed and immediately released, you will notice that the blue LED changes from a steady blue light to a blinking blue light. This indicates that you are in large dog mode. Large dog mode, as its name implies, is used for very large dogs. It is appropriate for patients weighing from 50 kilograms to about 120 kilograms. Pressing and releasing again puts you back into standard mode. Standard mode will ventilate patients ranging from about 1 kilogram up to about 60 kilograms. Again, large dog mode, patients over about 50 kilograms. The second function is a test mode. This mode is used to test the integrity of the inner bag and the anesthesia machine itself. To enter this mode, press and hold the button. You will see that the pressure starts to slowly come up. This shows the pressure rising from the flow meter. I now shut the flow meter off, and it holds at 20, proving the integrity of the anesthesia machine. If there was a leak, what would happen is the pressure would start to slowly decrease. Releasing the button lets the pressure release from the system. The final alarm we are going to discuss is the overpressure alarm. This can occur for a number of reasons. Usually, however, it occurs because the scavenger has somehow been blocked. If we disconnect the scavenger, start the ventilator, and I block the scavenger, the pressure will rise, and eventually you will hear the alarm. When the pressure has come down again, the alarm ceases. You will also sometimes hear it in test mode. In test mode, if the pressure from the incoming flow meter gets too high, Easy Breathe will cut out and you will hear the alarm. When you release the button, the pressure will come down and the alarm will turn off. Again, we hear the overpressure alarm. In most cases, the overpressure alarm is just temporary. I can also get that if I squeeze the bag. As soon as the pressure comes down to normal, it stops.